Louise, are you feeling okay?
I don't feel very good.
I think we should go find some help.
Now let's take a closer look at diabetic emergencies. When we talk about diabetic emergencies, we could get really intricate about what causes it, and is it insulin resistance and all that kind of stuff. But I think for the sake of this training, we're going to simplify it down to two major types of emergencies that can occur due to a diabetic emergency, and that is this: high blood sugar and low blood sugar. Now let's break those out a little bit. High blood sugar and low blood sugar, though they have the similar signs and symptoms, high blood sugar is different for a couple different reasons. High blood sugar can develop in hours to days, and when it develops, it's a little bit different in that it also shows some symptoms like a child needing to drink more often than normal. Maybe they're drinking more water, maybe they're drinking more pop, maybe they're just always thirsty. We call this polydipsia. Polydipsia is that insatiable thirst that they cannot quench. Now, when they have this symptom, it's usually accompanied with having to go to the bathroom a lot as well. That's another way that the body's trying to get rid of that excess sugar in their bloodstream and in their tissues, and that's by going to the bathroom a lot. So another sign or symptom. Now, backing up just a little bit, let's say that you didn't know that the child was a diabetic. These are sometimes the first signs of juvenile diabetes, is that we see a child drinking more than they usually do and going to the bathroom more than they usually do. Not that that's always for sure, but it's definitely a flag that should maybe bring us into the doctor and take a closer look. But now back on track with the high blood sugar. One of the last symptoms that's really bad and is usually at the tail end of a high blood sugar event is something we call ketoacidosis. Now, ketones can be actually smelled on the breath of a high blood sugar patient. It's usually like cheap wine or a fruity overtone, and that can be an indicator that the person is suffering from high blood sugar. So what can we really do about high blood sugar out in the field? Not a whole lot. We can activate emergency medical services or get the patient to an emergency room so that they can be definitively treated and get back on track. Now let's focus more on the one that you can do something about in the field, and that's low blood sugar. So in a low blood sugar event, it's different from high blood sugar in that it can come on within seconds to minutes, and it can surprise people. Whether they're a known diabetic or an unknown diabetic, the treatment should be about the same. So what is the goal of getting someone into a more stable position when they have a low blood sugar event and are showing those signs and symptoms of dizziness, lethargy? They might be confused, they might have slurred speech, they don't want to play anymore, they're grumpy. Getting them sugar. But there's different ways to get the sugar into their system faster than others, and I want to talk about that here in just a minute. There's lots of different food sources around that we can choose from, but not all of them will get the sugar into the bloodstream as quickly as the ones I'm going to talk about next. If you look at some of these high grain, high fiber snacks that are common at a picnic table, they're good, and in some cases they're good for you, but they're not necessarily good to treat a diabetic emergency. Meat sticks, granola bars, and chips are probably not our first choice to getting their blood sugar up. Though they can over a longer period of time, that's not our emergency treatment. I want to take a look at some that are a little bit faster and are more preferable under the treatment guidelines. Orange juice is a fantastic way to get their sugar up. In this one small bottle, there's literally 44 grams of sugar. They shouldn't have to drink much more than a third to a half of the full container to give them more than enough sugar to get their blood sugar level back to where it should be, get them thinking more clearly, and then buy us some time for EMS to arrive or to get them to their doctor or to an emergency room. A couple other options that you could use are over the counter. You can get them at most drugstores and probably some grocery stores. And that's glucose in the form of tablets, in the form of liquid, and in the form of a gel. The reason I like these is that they're closed, sealed bottles, and they're really stored in a more stable state. You know, we got orange juice here, but in most cases it needs to stay refrigerated. It has an expiration date that probably is a little faster than some of these other options. Now, I like these because depending on the child, they may have something that they like more than the other. Maybe they like chewing candy, so you would opt for the tabs. But keep in mind that you should know, and here's a little Roy hint, you might want to write on this the number that you should be using. Your doctor would probably tell you this because in this case, every tablet's only 4 grams of sugar. So you might think, well, it's 1 tab per treatment. In actuality, to equal the half of this bottle, you need 5 tablets. It's 4 grams per tablet. You would need 5 to equal the half a bottle of orange juice. The liquid here comes in like 22 grams by itself, and the gel is another 18 grams. So understanding how much sugar or glucose is actually in these tabs is important. Remember that these have been designed to absorb quickly into the digestive tract of the patient, and so they may work a little faster than like a candy or a regular soda. Now, one point of interest here when we come to drinking over-the-counter beverages is be careful of diet things. You know, diet sodas tend not to have any sweetener that's sugar-based or glucose-based at all. So I've had patients where they got treated with Diet Pop and their family members didn't understand why it didn't bring their loved one around. Well, it was because there wasn't any sugar in the soda. So make note of that. No Diet Pops, no diet candies. They won't work in this situation. The second point is that it can take up to 15 minutes to actually absorb the amount of glucose or sugar needed to reverse the effects of a hypoglycemic event. So remember, if this person is a known diabetic and the doctor is giving you a prescription of what to do if they have a low blood sugar event, it may be that after you give them the appropriate amount of sugar or glucose, that you wait 5, 10, 15 minutes to see if it reverses the hypoglycemic symptoms before you activate emergency medical services. However, if this is your first hypoglycemic event, it's going to be important to call 911 right away. The other piece here to note in closing is that when we have these different packages, they almost all come with a seal. You know, as I was preparing these for this instructional, I was picking at the actual seal and realized some of them are very difficult to undo. Now, keep in mind, some of the effects of the decreased level of consciousness and confusion is only going to make opening these that much more difficult. So if you can take the outer seal off, it's just a protective device so that you know that it has never been opened. Get it prepared so that you can open it more easily and consume its contents when it's an emergency and it counts. So I hope this helps. Wait for EMS. Watch the patient to develop any life-threatening problems. And if they do, we'll know what to do. We can move on to our next level of treatment.